Understanding the pathophysiology of osteomyelitis, basically we need to begin with what? Understanding the anatomy relating to what? Osteomyelitis. Very important point to take note of that, okay? So we need to understand the normal anatomy, okay? And also so that we can rush on to the what? Pathophysiology. Since we've understood the classification now, so now let us go undergo, let's go to what? Anatomy. So let's say now we're getting the long bone, because the reason why I'm getting the long bone, that's where the osteomyelitis commonly affects. So it's commonly affect what? Long bones, like the tibia, femur, humerus, like that. So those type of what? Long bones. So now remember that the long bone has parts. Okay, so let's start with the parts. Okay, what is this part? What we call this part? We call it what? Let's just use E, which is epiphysis. Okay, epiphysis part. Then what about this part where after this blue thing? So what do we call this blue thing? We call it what? Epiphyseal plate, okay, or the growth plate. Epiphyseal plate or the growth plate. This one. After that, beneath that there is this region which we call metaphyseal region, okay. Then after metaphyseal region, there is this part up to what? Where the another metaphysis is beginning like that. So this is what we call it? Diaphysis, okay? Diaphysis, like that, okay? So that is the other point. As you can see from below here, okay, from the bottom here, bottom part here, there is what? Another region. And after the growth plate, we know that that will be what? Epiphyseal region or epiphysis, okay? Then beneath that, okay, or above that, that is what? Metaphysis. Those are the regions that you can what? You can know, okay? What is the other important part? The important part is what? The blood supply to the what? Long bones, okay? Blood supply to the long bone, we need to understand it as well. So blood supply. So the blood supply now, blood supply. So let's just say BS. Blood supply, it's going to receive from what? The bone is going to be supplied by different blood vessel systems, okay? The first one is what? Nutrient artery system, the most important one. So let's just say nutrient artery system. So artery system, let's just say artery system, nutrient artery system, that's the first one. What is the second one? The second one is what? The second one is the metaphyseal and also epiphyseal type of what? Artery system. So let's just say E, epiphyseal. Then we say M, metaphyseal. These, they are categorized as one, okay? Metaphyseal what? System, like that. The last one is what? The last one is what? Periosteal system, okay? Periosteal. So how many arteries are really important in what? Blood supply to the long bones. There is what? Nutrient artery, epiphyseal, metaphyseal what? Systems. And there is also periosteal type of system that supplies what? A lot of what? Structures. Okay. So if you talk about the nutrient artery, it's going to supply about 2/3 of the what? Cortex. Okay. The cortex is going to be supplied 2/3 from the what? Nutrient artery. Then these two they just supply the what? The specific region, which is the epiphyseal region there and metaphyseal what? Region there. They are supplied by this what? These blood vessels. Okay. Then what about the periosteal? Periosteal system, they supply the periosteum as from the web, and as well as what? The outer 1/3 of the what? Cortex. So you need to understand that outer 1/3 of the cortex is supplied by what? Periosteal system. What about the 2/3? The 2/3 of the cortex is supplied by the what? Is supplied by the nutrient artery. Now let us look at these where we can find them. Okay. If you come here from the diagram, if you look at this artery, so what is this artery? Why is it located? It is located in the what? Epiphyseal what? Region. Okay. It is located in the what? Epiphyseal region. So if it is located in the epiphyseal region, what we call it? We call it what? Epiphyseal what? Artery. Then what about this one? The one that is located in the what? Metaphyseal region. So we call it what? Metaphyseal what? Artery. Okay. These two branches, these two arteries, are going to form a system which is epiphyseal, metaphyseal what? System. They're going to form this system. What is the other one? The other one, as you can see, this one which is on the what? Deficit what? Region. What do we call this? We call it what? Nutrient what? Artery. There's a nutrient artery vein and what? There's a nutrient vein and also nutrient what? Artery. They are going to pass, they are going to come from this side and enter into the what? Deficit in the medullary cavity there. In the medullary cavity using what? This red thing here, which is that foramen. We call it what? Nutrient foramen. What do we call this? We call it what? Nutrient foramen. Okay? Very important foramen. That's why now the nutrient artery is going to enter into the medullary cavity there. Okay? Again, if you look at this one, what do we call this one? Under metaphyseal region, we call it what? We call it metaphyseal artery. What about this one? We call it what? Epiphyseal what? Artery. Now, the important point that you need to take note of. This nutrient artery, the moment it enters into the what? Medullary cavity. As you can see there, inside there is what? A cavity, which we call medullary cavity. The moment it enters there, it will give two important branches. The ascending branch and the what? Descending branch. But the moment the ascending branch goes there in the what? Metaphyseal region, they are going to form what? Loop. They are going to form what? Hairpin what? Loop. Very, very important. So what do we call this? What do we call this? Okay, what do we call this? So what do we call it? Let me use blue. What do we call this? Okay, let me just say. So we call it what? Hairpin loop. Type of what? Arrangement. Okay, type of what? Arrangement. Hairpin loop, type of what? Arrangement. Very, very important part. Because this hairpin loop is the one that is very, really important in the what? Pathogenesis of what? Osteomyelitis. Because the way it is arranged is going to be what? Sluggish, like that, slow. When you talk about the type of flow there, which is stasis, turbulent, like that, okay? That basically the type of flow there is going to cause the colonization of what? Bacteria. So we'll talk about this one details from there, okay? So what else are you supposed to talk about? Okay, the other point is that you need to talk about is this one. Okay, you know, let's talk about the other parts which are important. Okay, we know that this where these arteries are, that is the medullary cavity. I'm not going to write that. Then this next part here, with the green part here, what do we call that? The green part, we call it what? We call it the cortex, or the compact what? Or mature bone, compact bone. Okay. Compact bone or mature bone. What is this outer part now? This outer part this outer part, okay? This one, these two lines, what do we call this? The one that covers, that protects the inner parts of the bone. What do we call this part? We call it what? The periosteum. Periosteum. Okay. Now, if you talk about the periosteum, okay, the periosteum is the one that I've magnified it here. So this is the periosteum. Okay, I'm going to magnify it. Why magnify it? Why do we have to stress ourselves under anatomy of the periosteum? Because it's also involved in the pathogenesis of what? Osteomyelitis. Remember, the periosteum stripping, so we need to understand what it means, stuff like that, if you understand the anatomy. Okay, so the periosteum now, as you can see, it has two parts as well. So there is outer part and the inner part. The red one is inner part. The blue one is what? Outer part. So the outer part, what do we call the outer part? This outer part, we call it what? We call it fibrous layer. Fibrous layer is going to have what? What type of cell does it going to have? It's going to have fibroblast cells. Then what about the inner layer? The inner layer, we call it what? Osteogenic layer or inner cambium what? Layer. So let's just say cambium what? Layer. And the cambium layer, what type of cells is it going to have? It's going to have what? Stem cells or osteoprogenitor what? Stem cells. Okay? Osteoprogenitor cells. Okay? And osteoprogenitor cells, we know that they're going to differentiate into what? Fibroblasts. And fibroblasts, what's the function of fibroblasts? They're going to what? Start depositing what? Bone. Okay? Very, very important to take note of that. Okay? Last part, we need to understand this. So I'm not stressing you enough. Okay, there will be a reason why I'm stressing enough on this. Okay, there's this also this point. Okay, you've seen this blue blue thing here, the horizontal one, what do we call this? We said that is what? Epiphyseal plate, okay, or the growth plate. This one is really important as well. The reason why it's important, because if you talk about the spread of what? Osteomyelitis disease, it can spread from what? If you talk about those people with what? The growth plate, the spreading of osteomyelitis to the adjacent what? Joint. Remember that if this is a bone, there will be another bone here, there. So, and there's a joint there, okay? So this infection, if it's affecting this area, it can't go there with someone having what? This growth plate, okay? So basically, it has been estimated that someone starting from what? 4 to what? They say the maximum is up to 16 years, 1 to 16 years, or others they say 3 to 18 years, like that. These are going to have the growth plate, and the spread of infection is not going to, this infection is not going to affect the joint, causing septic arthritis. No, because this epiphyseal plate is acting as a barrier. No wonder if you look at the adult they are going to have septic arthritis as one of the complications. Why? Because adult, the growth plate is what? Is going to disappear like that. If it disappears, then there will be communication of what? Metaphyseal arteries, and these metaphyseal arteries are not epiphyseal arteries. They're going to start communicating with one another, and the infection now can go into the epiphyseal region and enter into what? Joint, causing septic arthritis, which we'll talk about in the other video. Okay, so now since we've talked about that, okay, now let's talk about what? The pathophysiology. Let's talk about the pathophysiology. Now let's try to make everything sense out of that, okay? Let's try to make sense of that. So now, under the pathophysiology, it has some phases or steps for you to follow. What are those steps? Before I start talking about what happens there, it has what? Some steps. So it has what? The inflammatory phase. So let's use red. Inflammatory phase. So it has inflammation. This is the first step, okay? Okay, the second step is what? Suppuration or pus formation, okay? Number 3, it's going to have now, there will be now necrosis. Okay. Number 4, there will be new bone formation. SA formation. Okay, new bone formation. Number 5 is going to have now another one, which is what? So the other one is what? Resolution. So inflammation, suppuration, necrosis, new bone formation, and what? The resolution. These are what? 5 important steps when you start talking about what? The pathogenesis or pathophysiology of what? Osteomyelitis. I know it's a lot. So let's continue. Now, let's start with the inflammation, okay? How does it come about, the inflammation or the inflammatory response? How does it come about? So the inflammation, remember that if this is the blood, so this is the blood vessel, and this blood vessel, I've taken it from where? The metaphyseal region, where there is what? Where there is this hairpin, what? Looked, I've just magnified it and taken what? Just one blood vessel like that, okay, and magnify on that. As you can see, we're able to see the endothelial cells there, the endothelial lining like that, okay. Now, if the bacteria, let's say the Staphylococcus aureus, which is the most common cause, find itself there, okay, it is there, the Staphylococcus aureus is there, okay, and it can come from different locations. Since this is VAR blood, it is under what? Hematogenous state. So let's use a hematogenous type of what? Osteomyelitis, because it will be easy to understand through this route, okay? Hematogenous type of osteomyelitis. Remember, what are the causative things of hematogenous type of osteomyelitis? We said the infection, maybe someone had upper respiratory tract infection, like what? Pharyngitis. Someone also had what? Urinary tract infection, UTI. So regardless of that, they find themselves in the what? In the blood like that. In the blood, the moment they go in the blood, from systemic arteries like that, they will feed into the what? Into the medullary cavity via the nutrient artery, then they'll go there on the metaphysal what region where there is what hairpin loop type of what arrangement. This is it now. Okay, that's where the Staphylococcus aureus is. Okay, and it is feeling nice. Now there are some factors that we need to talk about that will make this Staphylococcus and this Staphylococcus to start what attacking this endothelial line in there and causing damage to that endothelial line. What are those factors that are promoting that? So let's write them here. What are those factors? The first factor is what? The first factor is because of what? The hairpin loop arrangement. So the arrangement. So let's just say the hairpin what? Loop arrangement. So the arrangement of what? Vessel. Okay, the arrangement of what vessel is the reason why it is what making sure that it is good. It's going to attack the what? The endothelial line in there. Okay, that's the first one. The second one is what? It's because of what? Blood flow. The second reason is what? It's because of what? Blood flow. Blood flow is what? Turbulent. Turbulent, and what is what is the stasis of blood there. So that is the second reason why bacteria start attacking the what the endothelial line in there. What is the last reason? What is the last reason? Do you know that? We know. Okay? We know. I got you. So what is the other reason? The other reason is what? If you look at the lining in there, the lining of the leukocyte, the lining of the white blood cells there, it's not there. Okay? Or they might be there, but there are few lining of the what? Leukocyte. So what are we saying here? We are saying decrease in the lining of what? Leukocyte there. Decrease in the what? Lining of leukocytes. Okay, that's the main reason why they start. If there is decreased lining of the leukocyte and few leukocytes that are there, what will happen? This clearance of what? Bacteria won't be effective. The phagocytosis won't be effective because there are few white blood cells that can be found on the metaphysis region there. Now the question is, why do you think there are few white blood cells there? Because this system is not part of what? Reticular endothelial system for fighting infection. The reason why there is this type of arrangement here, which is the hairpin loop arrangement, is because of what? It's because we need maximum blood for what? Growth and what? Repair, like that. Okay, for growth and repair, that's the main reason why they start. Okay, yeah. So now, since we understood, due to this, it will promote this now bacteria to start now attacking what? To start attacking this. Okay, to start attacking this. If now this is attacked, what do you think? There will be now there will be what? An inflammatory response, because these endothelial cells, they will start producing what? Cytokines like that. If they start producing cytokines like what? Tumor necrosis factor alpha, interleukin 1, interleukin 6. If they start producing that, what do you think to the endothelial lining? There will be what? Increase in the permeability. So the important, because of due to inflammation, what do you think is going to happen? There will be increase in the what? Permeability in this what? Endothelial what? Cells. Okay? There will be increase in the what? Permeability. If there is increase in the permeability here, then what do you think is going to happen? Remember that this is the fluid which is here. This is the fluid which is here. So what do you think? The fluid will start leaking here. Okay, to start leaking here, along with what? The bacteria here. Okay, the fluid, proteins, everything will start leaking into what? What is this area? We call it what? Medullary cavity. So this is the cavity, medullary what? Cavity. That's where everything will start leaking due to what? This inflammatory response. Okay, and remember that there are some few blood vessels that are there that will help at least to clear out that. But even if they are there, but they are not effective. Okay, they will just be producing cytokine that will also promote what? Increasing the endothelial permeability. Okay, like that, and also there will be what? Vasodilatation. Okay, so if that happens now, here there is fluid, there is edema there. Okay, there is edema. What do you think now if there is edema here? If there is edema, this fluid will continue like accumulating. If it continues accumulating, what do you think is going to lead? It's going to lead to what? Okay, it's going to lead to, let's write it here. Okay, so what do you think the fluid will start doing here? It will start, there will be increase in the what? increase, so they will be increasing the what? Pressure. We call it intraosseous pressure. Intraosseous pressure. They will be increasing the what? Intraosseous what? Pressure. Because of this fluid that is coming from the blood vessel there, okay? It will increase that pressure, okay? This pressure is one of the what? Reason why someone with osteomyelitis, they are going to have what? Pain, okay? So what's the main reason for this? So the main reason is, see, the result for increasing the intraosseous pressure is, see, going to cause what? Pain, okay? Otherwise, for acute type of osteomyelitis, it is what? Thrombin type of what? Pain. For chronic, it will be what? Chronic type of what? Pain, okay? So there will be what? Pain there, okay? Pain will be produced here, okay? There will be pain that's going to be produced. What else? So the reason why pain is going to be produced, because here surrounding this medullary cavity there are some nerves that will be there. Then that pressure is compressing against those nerve fibers. Okay, those nerve fibers now they will start transmitting pain to the brain so that you can feel what? Pain. That's the main reason why there will be pain there. Compressing against what? The nerves that are surrounding them. Okay. Now let's go. So that's why the inflammatory phase ends from. Then we go to what? Saturation. So the inflammatory phase ends from where now the fluid is going to increase the intraosseous what? Pressure, causing what? Pain. Okay. And remember that the other thing about inflammation, what can cause the other effect that can come about from the inflammatory response apart from pain, it can also remember that those systemic effect of inflammation. Okay, what is that? Fever. There will be fever there. Okay, so what is the other effect of this? The other effect of this is what? There will be what? Fever. Okay, because those interleukins, if they go to the brain, they're going to what? They're going to stimulate what? Fever. Okay, there will be fever, a lot of things. Then also here under pain, someone is not going to be using their limbs. They are like, especially in children like that, they are able to use their limbs, but they are failing due to pain, and we will call that pseudoparalysis. They are able to what? They are able to move their limbs, but due to pain they can't what? They can't use their limbs. That is what we call pseudoparalysis. Okay, so there will be also pseudoparalysis due to pain. What else apart from that? So apart from pseudoparalysis, if you try to move them like that, they will feel intense pain like that, because that the moment you move them, there will be that increase in the stimulation of pain fibers causing intense pain. So that is what we call motion tenderness. Okay, motion tenderness. The moment you move them, they're going to feel what? Pain. So those are the clinical features that you can see from someone having that. Okay. Now let's go to suppuration. So suppuration, what is that? Now that is what? Pus formation. How does pus forms? Okay. This fluid which is here, okay, which is here, as you can see, this bacteria now will be like, maybe since there is ineffective phagocytosis and other things like that, now the combination of what? This pus, the combination of white blood cells, the combination of fluid proteins, then it's going to cause what we call pus. So in longer time, this edema that was coming here, so this edema can be converted into what? Pus. So this edema that we're talking about will be converted into what? Pus in due time. Okay, it will be converted into pus. That is suppuration what? Phase. Now it doesn't end from there. Okay, this edema, conversion of edema to pus, basically that is what? Suppuration. But this suppuration phase doesn't end from there. It has to do something as well. Very important. You've seen this. So this CC, there's still increasing pressure. So the pressure is building up. Remember that the bone is rigid. The bone is what? Rigid. Can't expand like that. What do you think? The pressure will start what? It will be just increasing. Now the fluid will start seeping out into what? Various what? Canals. You've seen this canal. Okay, this canal. So this canal is what we call Volkmann's canal, the one that's going like this. Okay, so there is something here, important point. Volkmann's what? Canal. So Volkmann's canal. Okay, so Volkmann's canal, these are the ones that are going like that. So this fluid now, it will start doing is that this fluid will start going into what? Volkmann's canal like that. Because the bone can't expand like that, then the fluid will start escaping from the what? Medullary cavity going in the what? Volkmann canal. Remember that the Volkmann canal and Avian system, where can you find them? You can find them within the what? Compact what? Bone. Okay, so this fluid will start leaking there. Okay, leaking there. Remember that this is also what? This is the vertical ones. These are what? Avian system like that. Okay. Now fluid will start going like that. Remember that it is going toward what? This is what? The periosteum. So let's just name it P. This is the periosteum. To start going to the periosteum. Now, what will happen to the periosteum is like this. So this fluid, the moment fluid comes here, it will come here. So this is the fluid, it will come here. Okay, it will come here. It will come where? Between this cortex or this compact bone and the what? Periosteum. Then what will happen to the periosteum? It's going to be lift up like that. It's going to be what? Lift up like that. Okay, it's going to be lift up like that. Yes, like that, like that. It's going to be lift up like that. So then what do we call this? We call it subperiosteal abscess. Okay, abscess. Subperiosteal abscess. Sorry. Okay, subperiosteal abscess like that. Subperiosteal abscess. So subperiosteal abscess is because of this pus that is coming from the medullary cavity going to Volkmann's canal, then up until they reach the what? The periosteum there. So the inner part of the periosteum now is going to be lifted away from the what? From the compact bone like that. Okay. Then forming what we call subperiosteal what? Abscess. Subperiosteal abscess. So that's how the subperiosteal abscess is going to be formed. Now, there's also an important point that's going to happen, okay? So if this is subperiosteal abscess going to be formed, now something else is going to start happening, okay? Remember that if you come back here, there's increase in the what? Pressure here, leading to what? This escape of what? Pus. Remember that again, under the what? Medullary cavity, there are some what? Blood vessels that are there. Remember that the medullary cavity, it has this ascending and descending branch, whether arteries or veins like that, okay? It has that. Now, if it has that now, remember that if there is pressure here, what's going to happen? It will start what? Compressing against this what? Medullary type of what? Veins that can be found in the medullary cavity. To start compressing that against that. Okay. Yes. So now what will happen is that if it is compressing against that, what do you think? What do you think is going to happen? Okay. There will be now reduced what? Blood supply. Okay. Due to what? Increasing intramedullary what? Pressure or intraosseous what? Pressure. It will be reduced what? Blood supply due to what? Compression in the what? Artery and the veins. Okay, but what you need to understand is that initially what happens is that the veins they're going to be what? Compressed firstly, okay, causing congestion in the venous what? Circulation. Then lastly it will start compressing against what? Arteries, causing low blood supply to what? To tissues or to cells. Okay, to cells like osteocytes. Okay, now if that happens now, what do you think if there is no blood supply to the cells like osteocytes? What do you think? It will lead to what? Necrosis, because cells are not receiving enough what? Blood due to what? That compression that we're from talking about. So now that is the transition from saturation to what? Necrosis. Okay, necrosis comes about because this saturation, this pus is building up in the what? In the medullary cavity, as well as it's lifting the what? The periosteum. Okay. Then if that happens, it can lead to what? Necrosis. Why necrosis? Because now the cells within the bone, they are not receiving what? Enough what? Blood. They are not receiving enough oxygen. They are not receiving enough nutrients, causing what? Necrosis. Okay. And remember that if you talk about the periosteum as well, periosteum, it is rich in blood supply. If you remember, because we talked about it. If you talk about the blood vessels here, we said it has a lot of blood vessels here. These blood vessels, periosteal system type of blood vessels. But if you lift, the moment you lift this periosteum, you're going also to disrupt the blood vessels that are going to the periosteum. What do you think? If you disturb those blood vessels, again, it's going to lead to necrosis. Okay, now let's talk about the same necrosis. So necrosis, what are we talking about? Okay, so let's leave a space here. So this is necrosis. That's going to happen. So this is necrosis. So this is now within the medullary cavity. There will be necrosis. Okay, so there will be this bone here. Okay, this is the bone now which is undergoing what? Necrosis. It's undergoing what? Necrosis. This bone is undergoing necrosis. What do we call this bone which is undergoing necrosis? We call it what? We call it, so the bone that is undergoing necrosis, what do we call that? We call it what? Sequestrum. So the bone that is undergoing necrosis, we call it what? Sequestrum. Sequestrum is just a necrotic bone that was due to what? Decrease in what? Blood flow to the what? To the bone cells. Due to what? We said due to what? Blood vessel what? Congestion. Okay, that's what we talked about. So if you see sequestrum, it's because of what? There was reduction in the what? Blood supply to the osteocytes. Okay. Now, another thing that's going to happen. So this is step by step that I'm talking about. Okay. So now after necrosis, then what's going to happen? There will be new bone formation. This periosteum that was lifted like that, it was lifted like that, it will start now, it will be activated. Remember that, what did we say? If you come back here to the anatomy, we said the periosteum has what? Two important layers, fibrous layer and what? The cambium layer or osteogenic layer. This cambium layer is going to be activated. The stem cells will be activated and they will start programming themselves to start changing or differentiating into what we call osteoblasts, and those osteoblasts will go where? Okay, this osteoblasts that will come from this inner layer, they'll come here. Okay, they'll come here. These are fibroblasts like that. They'll come there. Okay, they will see, okay, this is a necrotic bone, and we need to protect what? The bone, because if this necrosis continues, this bone can break like that. So what are we going to do? We'll start what? We'll start producing something. So we'll start producing what? Bone. We start producing what? A bone around this what? Necrotic bone. So we start forming a new bone around what? This necrotic bone. So that's what they will start doing. Okay, that's what they will start doing. That's what they will start doing. So what do we call that? What do we call that new bone formation? We call it what? Involucrum. Okay, involucrum. So due to this sequestrum, okay, there will be another new bone formation, which we call involucrum. Okay, involucrum is basically what? The new bone produced. New bone produced, and it's going to cover the what? The sequestrum. It's going to cover what? The sequestrum. Why covering the sequestrum? So that at least somehow to prevent the infection from spreading. And remember that, and also to prevent what? The bone to become weak and prone to what? Fractures. Okay, so that's the reason why it's going to happen like that. Okay, and inside this necrotic bone there are a lot of substances that are there. These substances that we talked about, the bacteria, they are there, proteins, white blood cells, they are there. Basically inside this necrotic bone is what? Pus inside there. Okay, very, very important to take note of that. Yeah. Now we go to what? Resolution. Okay, the last one is what? Resolution. The last one is what? Resolution. This one, the last one. So resolution basically it means that it's based on what? Treatment, or the bone starts what? Healing. Basically after what? Oh my God. After some treatment. Okay, someone has undergone now some treatment that we'll talk about here. Okay, they are going to remove this necrotic what? Bone. Basically, maybe they are going to drain that pus, or they are going to remove that necrotic bone by the surgical method, which we call sequestrectomy. Okay, they remove that. If the moment they remove that sequestrum, then basically it can lead to what? Resolution. Resolution basically is the healing of that affected bone. There are different ways. It can heal maybe because of the patient was given antibiotics, okay? Or maybe it was the necrotic bone was removed via the process, via the surgical method called sequestrectomy. The other one is maybe debridement. There are a lot of surgical method that they can use, but after that it can lead to healing or resolution. Okay, another last point. So we need to talk about this one, broad. Okay, this one, the one which we talked about, the Brody's abscess. Okay, the Brody's abscess. So the Brody's abscess. Okay, the Brody's abscess. Now, how does it? So I haven't talked about the Brody's abscess here. Okay, so Brody's abscess, it can be formed like this. Okay, it can be formed like this. This pus that was formed within the medullary cavity. Okay, now it is formed just within the metaphysis region there. So that pus that was formed in the medullary cavity, now it is leaking into the the metaphysis region there. Basically, if you look at the metaphysis region, that's why you can find the sponge bone there. But you find pus within the sponge bone. Basically, that is the Brody's abscess. And Brody's abscess, one of the classic kind for we said subacute type of osteomyelitis. Okay, it's a lot. Now we try to summarize everything. So we try to summarize everything. Okay, let us try to summarize everything. Something. Okay. So now we summarize. So now let's relate to something else. And so let's relate to something else. So let's relate to acute. So what you can say under acute osteomyelitis, what you can see. Subacute, or I mean post-acute, what you can see there. So what you can see under post-acute, under subacute, under also what you can see under chronic. Okay, very important part. Okay, because you are going to be assessed on that. Acute, what you can see is just aid inflammation. So what you can see is this one for acute, aid inflammation. Okay, post-acute, now that's why you can. So although here you are going to see inflammation and saturation, you can see this. Okay, saturation like that. Okay, under post-acute, what you can really see is saturation. Okay, saturation, you can see saturation there. Okay, subacute, now here you are not going, okay, you are going to see saturation, but there will be no this one subperiosteal abscess here. So there will be this one, the one that I'm talking about, which is Brody's abscess. Brody's abscess. I'm going to see the Brody's abscess. Chronic is very important one. You need to take note of this. So chronic, what can you see? You can see now new bone formation. I mean, it starts from necrosis. So it starts from necrosis, then ending with new bone formation like that. So now for necrosis, what did you say? Necrosis, you are able to see the sequestrum. You are able to see you are able to see the new bone formation, which is said involucrum. Okay, another point, sinus sinus tract and cloaca. Okay, sinus tract and cloaca. So those are the important ones. So let us now talk about the sinus tract and cloaca. I didn't talk about that. So if you come here, this is the pus that was formed here. Again, the pus within the medullary cavity there, the pus will start building up again, because the bacteria is not dead inside there. Okay, the pus will start building up. Also, the pressure within the pus is going to build up. Why do you think this is going to happen? This involucrum that came here, this bone that was surrounding that bone that was surrounding that, which we call involucrum, is going to break like that. It's going to break. Okay, it's going to break and forming like that tract like that. Okay, why do we call this tract? We call it cloaca. Okay, cloaca is just the passage of the passage through the what involucrum up to the what sequestrum there. That's a passage which we call cloaca. Now this cloaca can continue going like that. It can continue passing through the what? It can pass through the what? It can pass through the cortical bone, okay? And it can pass through the what? Periosteum, like that. And it can pass, remember that from this periosteum there's a skin there, again outside the what? The skin, forming what? This whole thing is what we call sinus what? Tract. This whole thing is what we call sinus tract. So make sure that you understand cloaca and sinus tract, these are two different things. Cloaca is just the passage from the what? Sequestrum up to what? Through the what? Through the involucrum, then up to like outside there, basically in the medullary cavity. Now if the tract continues passing through the cortex, passing through the periosteum, then outside the what? Outside the skin there, forming what we call sinus tract. And it's one of the clinical aspect or clinical feature of what? Chronic type of osteomyelitis. Very, very important. And when I said necrosis, new bone formation, sinus tract, and what? Cloaca. Very important notes to take note. Okay. Now, what are the complications? So the complication can be what? So there are a lot of complications that can arise from what? From someone having osteomyelitis. There will be what? You know, there will be a lot of toxic shock. So there are toxic shock. There will be what? Sepsis. There will be what? Deformities. Okay. There will be deformities. There will be chronic pain. Okay. Formation, so there will be what? Margarine ulcers. Okay. So basically it can lead someone to have like a cancer like that. Prone for cancer like that. Okay. Then what else? It can lead to like some certain condition, like maybe it can lead to what? AKI, acute kidney injury. Okay. There are a lot of complications that you can see. Okay. Now, from here now, okay, and if you look at children, so the last one is what? Growth plate arrest. Okay. So a lot of complication. So now, from now, in the next video, we'll talk about the investigations. We'll talk about as well the maybe if someone comes in with the osteomyelitis, how can you treat how can you diagnose someone with osteomyelitis? The imaging that are there, which are very important. Okay, we'll talk about that. Okay, and also the treatment modality on how you can treat someone with what? Osteomyelitis. Stay tuned. Make sure that you study more. All the best.